am honored and grateful to have this opportunity to share highlights of our progress and achievements from the past year. First, I would like to acknowledge and raise my hands up to our First Nation leadership, communities, elders, and staff. I would also like to raise my hands up to our healthcare workers who have supported us through another challenging year. We acknowledge the challenges that have touched us all this past year with public health and environmental emergencies. I am proud of our communities who have come together with partners to support each other through these crises. The Fraser Salish FNHA team continues to prioritize approaches to support individuals, families, and communities to respond to and mitigate the impacts of the toxic drug emergency. First Nations remain overrepresented in drug poisoning events, and our response has been focused on reducing and eliminating these events through a wraparound harm reduction approach. The team is working alongside communities and other health partners to provide urgent and immediate responses, along with providing workshops and using train-the-trainer approaches to increase community capacity, focusing on traditional wellness, cultural safety, and decolonized health literacy. FNHA is partnered with the Chiam First Nation and Fraser Health Authority to build and implement the province's first community-based overdose prevention site that is led by a First Nation community. The site combines an indoor and outdoor space as well as a mobile component, all aimed at reducing the harms associated with substance use. The mobile unit will help extend the reach of services for others living in Stalo territory. We are transitioning from an emergency pandemic response to living with COVID-19. The Fraser Salish team has been collaborating with the Fraser Health Authority, along with organizing a mobile vaccination approach to help reduce pressure and alleviate community burnout. Thank you to our community's healthcare workers, leaders, and staff for working so hard to keep our communities safe and healthy during this long pandemic. In March, a groundbreaking ceremony was held for the Stalo Community Campus, which will be one of the region's 3 First Nations-led primary care centers. When complete, it will combine primary health care, social services, and Indigenous health supports into one team to provide accessible, culturally safe, person-first healthcare. The region's leadership was able to gather in person for the first time in over 2 years at Spring Caucus. Important steps were made in several key areas. In addition, the regional team supported coordinating community members and staff to attend Gathering Wisdom 12, which led to the ratifying of the groundbreaking 10-year strategy on the social determinants of health. I express my gratitude to the First Nations in our region for your continued strength and resilience. We have all come through several years which changed our world and how we work together. We learned to work differently and at the same time allowed us to find different and better ways to partner. To find out even more about the progress made throughout the region this past year, be sure to read the full 2022-23 annual report at fnha.ca.